On behalf of the Patient Safety Authority, I'd like to welcome you to today's Tips from the Toolbox webinar, Stop Scabies. My name is Joanne Atkins, and I am the moderator for today's web conference, which is scheduled for 30 minutes, including questions and answers. It is my pleasure to introduce Sharon Bradley, Senior Infection Prevention Analyst. Sharon is a registered nurse and a board-certified infection preventionist. She has practiced for over 45 years in clinical, education, risk, administrative, and patient safety roles, both in acute care and long-term care. Ms. Bradley has presented at national conferences for the CDC, APIC, and AVA. Sharon has authored multiple infection prevention and control journal articles and has provided educational programs on infection control topics for national risk management and patient safety organizations, hospitals, long-term care, and ambulatory surgery at a national, state, and local conferences. She is an infection prevention lecturer at the Philadelphia College of Osteopathic Medicine. I will now turn the presentation over to Sharon.
Thanks, Joanne, and welcome everyone. So you may be wondering why we chose scabies as a topic to build the toolbox. In April of 2014, the Patient Safety Authority added scabies to our list of reportable healthcare-associated infections. The purpose of the update was to be consistent with the revised national McGear criteria for long-term care infections. So now, for the first time, we have some idea of the burden of scabies in Pennsylvania healthcare facilities. So for the first 19 months that we used the new scabies criteria, long-term care facilities reported 484 cases and 37 outbreaks. Now that averaged about 40 cases and 3 scabies outbreaks every month somewhere in the Commonwealth's nursing homes. Now for hospital and ambulatory surgical facilities, they aren't required to report scabies into the CDC and HSN reporting system because they don't have an infection criteria for scabies. But hospitals and ambulatory surgery facilities are required by Pennsylvania law to report infection control events into PACERS, and that's the Pennsylvania Patient Safety Reporting System. So we analyzed those event report narratives from hospitals and surgical facilities, and we were able to identify certain trends and system gaps in scabies control in facilities that didn't actually report them as an infection. The gaps that were identified were associated with poor communication, which led to delays in diagnosis, treatment, isolation, and identification of contacts or exposures. And it also identified that surgeries were canceled because of people with active scabies. And my personal interest in scabies stems from the chaos I experienced in dealing with outbreaks with both classic and Norwegian or crusted scabies in both hospital and intensive care and long-term care settings. Now, those experiences and the updated research I was able to do contributed to the development of this toolbox and to action items that we're going to talk about that can be reasonably implemented in any healthcare setting.